Hi there. I want to talk to you today about the difference between traditional Western medicine and functional medicine as it's practiced in this country. You may be hearing the term functional medicine or a functional approach. This is a buzzword these days, and partly because it is a direction that many physicians are finding valuable and are taking significant steps to bring that to their patients. And I want to tell you a little bit about what that means. So probably the best explanation of the difference between functional medicine and traditional medicine that I've heard is it's the difference between what and why. So in traditional medicine, what is happening? What are your symptoms? What is your diagnosis? And then what is your pill that goes with your diagnosis? That is kind of the practice of traditional medicine. There's not a lot of digging deep and dissecting into the problem to find out the why. And that's not to say or dismiss traditional medicine in any way, but that is to say that the focus is on diagnosing. That's your focus. You're seeing a certain number of patients a day and you need to go into the room. You need to find out what this problem is, diagnose it, and then treat it with a pill. And that is the traditional medicine model. However, functional medicine is much more focused on why. What is going on? Why are these symptoms happening? What is the trigger? How can we address that? So digging into the deeper concerns of the root cause of why something is happening to a person, and recognizing that the same diagnosis may come to the table with many different whys as the root cause. So you may have the what, the diagnosis, nailed down and no problem. But the why behind it may be a little bit different from one person to the next. So in functional medicine, the focus is in finding out why is this happening, and if you can get to the why, well, then you can address the why. You can get to the root cause. Then you can address the root cause of the problem, and potentially improve the symptoms and potentially reverse the disease. So that is the thought process behind functional medicine and a functional approach to a patient. So that is why it is such a powerful model. And it catches those patients. So there are many patients that come through in traditional medicine who have a set of symptoms that don't have a diagnosis box. It's not, they're not obviously put in a simple box diagnosis. And these are the patients that fall through and get very, very frustrated because they continue to tell their physicians that something is wrong. They know something is wrong. These are the symptoms. But because that's the symptoms that they're having don't fit a specific diagnosis or a specific box that the traditional medicine practitioner can check mark, they don't know what's going on. Now, there may be a lot of testing that happens in trying to appease the patient or trying to figure out what might be going on. But quite often what happens is in the end, the doctor will come back in the room and say, listen, all of your tests were completely normal and I don't know what to tell you, you're fine. And the patient knows good and well they're not fine because they're having all of these symptoms. So these are patients who tend to get frustrated with the traditional medicine model. And also the patients who've often been told by their doctor, listen, maybe it's just in your head, or I don't know what's wrong. It's probably nothing. Don't worry about it. And they know better. And so they're looking for answers. And so a functional approach to medicine or a functional medicine physician may really be the physician who's going to catch what's actually happening with those people. Functional medicine physicians understand that it doesn't matter if you can put them in a diagnosis box. What matters is the symptoms. The symptoms are your body telling you that something is wrong. And and so even if your symptoms don't follow a specific traditional diagnosis pattern, it doesn't mean that there isn't something going on, and it doesn't mean that there isn't something we can do to help you. So I hope that helps to kind of delineate a little bit clearer what the difference is between a traditional medicine model of practice in medicine and functional medicine. And I hope that kind of gives you an idea of what we do in functional medicine and why we do it. And how we can capture some patients that are falling through the cracks in traditional medicine and be able to help them to find the root cause of their problems or to reverse these random symptoms that they're having that don't seem to fit in a box. So I hope that helps. If you're one of these people if this speaks to you and you're like, oh my God, yes, that's happened to me, or oh my gosh, I totally understand what you're saying, Dr. Campbell. If this is you and you totally get what I'm saying and you want to express to someone all of these symptoms and get an idea of what may be going on, I offer you a quick a questionnaire that you can take that can give you an opportunity to kind of express all of those symptoms and show me how significant those symptoms are in impacting your life and your health and wellness and your ability to function. And I'll also offer you a 15-minute discovery call so we can discuss these results. And I can give you an idea of what functional medicine may or may not be able to do to help you. No obligation, just free to kind of help you get a feel for what's going on in your life. It's my passion to help as many people as I can to find out what's going on and to find some natural methods to improving symptoms or improving your life and your health and your wellness. Again, my name is Dr. Christina Campbell. I'm a functional medicine physician, board certified in emergency medicine, and I've been practicing medicine for over 20 years. Functional medicine has absolutely changed and saved my personal life, my personal health journey. And because of that, I became very passionate about sharing it with others who've fallen through the system or who have not had answers or who got answers but still aren't getting aren't finding improvement in their symptoms or improvement in their outcomes. So I'm here to help you. Please reach out to me. Click on the link and take the questionnaire and then set up a call with me and we'll talk about it. And let's figure out what's going on with you. Have a great day.